Thank you, Chair. Dr Kennedy, I should say at the outset, I'm sure we like to live in a world where there are no estimates variations, but if there have to be estimates variations, I think this kind is preferable to the alternative, the kind where taxpayers are going to expend $60 billion less and therefore $60 billion less is going to be borrowed than was the alternative. But perhaps for context, it might be helpful for you to explain to the committee and those watching how a demand-driven program differs from other sorts of programs where a specific amount is appropriated.
Yes, Senator. Part of the advice around the design of this program and the reason we provided the advice that we did around the expansion of the Job Seeker program, the COVID-19 supplement, was because as it became clear through March, the range of scenarios that were emerging were wide. So the first package, for example, it had demand-driven elements in it, such as the investment allowance, but it was more a program targeted at roughly 1% of GDP in the face of a shock that could have, that was proportionate to the shock.
That was the first package, you say?
That was the very first package. In the second and third packages, and the third package really was an extension in some ways of the second package, the scenario we faced became very uncertain. And so what the advice that we were providing was that whatever actions the government took, they should be robust to whatever scenario emerged. And demand-driven programs, by their nature, are robust to those to what are those scenarios, to a scenario such as that emerging. So we had looked at the advice, for example, of the OECD, which had suggested 25 to 35% falls in GDP for the extent that a lockdown was in place. And we are seeing estimates out of Europe at the moment where, for example, in INSEE, the national statistical body in France, is talking about the French economy during their confinement period, their lockdown, being 31% below what it was pre-COVID, now 21% below what it was. As the Finance Minister mentioned, the wage subsidy program in New Zealand will cover, it looks like, about 60% of their labour force. What really drives the variation in the coverage of this demand-driven program is the extent to which you lock down.
And sorry, I do want to explore that, but just before we get there, it's even more elementary than that. From a budget point of view, how does a demand-driven program where criteria are established to qualify for the program and therefore forecasts or estimates need to be made about how many people will meet that criteria, how does that differ from other sorts of budget programs where a specific appropriation is allocated and we will spend this much money on for these reasons?
In simple terms, one has to derive an estimate of the amount of demand for that program, so the extent to which it will be used.
You was about to make a very important point on New Zealand, though, given the size. I mean, we had a much less severe lockdown in Australia.
Yeah, and I'm coming to that. That's a follow-up question.
And that was really just to illustrate that if a program is in much greater demand, much greater need, or there's much greater take-up. Now that take-up can change for a variety of reasons, the underlying demand, but also because, particularly in a newly designed program, one has to be careful about understanding who will take it up.
Exactly.
And the incentives to take it up, and the distribution of those incentives across the damage that might be being done in those circumstances.
So yeah, that's what I'm trying to understand. Because human behaviour is complex and you can't say for certain how people will respond to a program, there's a necessary degree of uncertainty involved inherently in any demand-driven program. And so therefore the estimates or the forecasts that you make are conditional on the information that you have at the time and the assumptions that you make. So coming to that point, when this program was being designed in late March, what was the health information that was available to you that you were using as an input to try and work out how many people are going to need to qualify for this?
So at that stage we had no formal modelling of the evolution of the disease in Australia. We did have the indicative modelling that was being done by the Doherty Institute that looked at a range of scenarios. I've outlined those in my statement. And they were scenarios that were going to potentially, if the disease spread, put very significant demand on our health system. These aren't sort of theoretical propositions. We can look at many countries with very similar health systems to our own, the UK being a very good example, where fatalities are in the tens of thousands.
Yep.
So they are quite plausible scenarios. Very fortunately, the sequence of decision-making in Australia means our scenario, and very fortunately for New Zealand and a couple of other countries, we've been able to contain this virus significantly.
Yeah,
but at that stage, in terms of what measures would be required to contain the virus, was not clear. You may recall, Senator, around those times, there were a number of calls, including from public commentators, about the importance of locking down the Australian economy. People weren't being particularly clear what that meant, but to lock it down to just essential services means, for example, the difference in what that would have meant for the construction industry in Australia, which looks like it fell by about 6 or 7% in Australia,
Yep.
looks like it fell by about 80% in France. So a lockdown where industries are not able to operate at all except for a very small number of essential industries is quite different to the type of measures that we subsequently put in place. It was that type of uncertainty that we were dealing with in costing this measure. The differences here are large. I acknowledge the differences are large. They're large because the difference in the forecast for GDP in that quarter could have varied between 20 to 24% and 10 to 12%. And hopefully now it will be even less. But that's the scale of a global pandemic and the difference that it can make inside any country.
Indeed, and the differences in the best health modelling that was available at the time and what has actually happened are also large. I mean, that Doherty Institute modelling that you're referring to forecast that at the low end, Australia would have 50,000 deaths from COVID-19 and up to 150,000. It forecast that there would be millions of infections rather than 7,500 infections, which we currently have. It forecast that our ICU capacity limit would be hit very quickly, that we wouldn't have enough ventilators to go around. So if that was the only information that you had to make your assumptions on, I guess it's understandable that the economic reality, which has been very different, will cause these kind of estimates variations.
Well, as I said earlier, the demand-driven nature of this program is crucial, because if we designed a program that simply paid cash payments to a different group, that would be a fixed amount. And where we didn't understand fully the extent of the shock that Australia would face, but we could see what was occurring in other countries, Italy, for example, Spain, where the Spanish central bank has been reported overnight as saying that their economy might fall by as much as 20% in the June quarter. We had to design measures that were robust to those outcomes. Obviously, the health decisions that were being made by the premiers, chief ministers and led through National Cabinet by the Prime Minister were going to be crucial, but we did not know the outcome of those measures just yet. So we designed a program that was robust to those scenarios, but costed against the more severe scenario. And then we watched and waited to the scenario until circumstances unfolded.
So I guess you didn't understand what the health outcomes were going to be for sure, and therefore the flow-on consequences for the economy. I guess you didn't also know how long those restrictions would need to be in place. I know the Prime Minister was saying publicly at the time that this could go for as long as 6 months. It might be necessary to have these measures for 6 months. In the end, it looks like we're going to wind down many, if not all of those, well before that 6 months. That obviously has a profound implication for things like JobKeeper.
It does, Senator. The base case scenario, or the one around the 10 to 12% fall, was assuming the set of restrictions that ultimately got put in place would be for 6 months, and that was the advice at that, that would be needed for 6 months, and that was the advice at that stage. It was our choice to choose an 8-week lockdown followed by a fallback to the restrictions that were being put in place in late March to fight. But we felt that was a plausible, severe scenario in the face of the fact that other countries were in the midst of that, and some of them actually locked down for longer and are still locked down for longer. Others have managed to do it for much shorter, New Zealand being the standout example. But most countries have locked down for at least 2 months or if not longer. And their lockdowns have varied. So the impact has varied. I should say it's not just the lockdown. If the disease had been spreading through the country and intensive cares were being overwhelmed or the health system was under pressure, there would have been a very large withdrawal from just normal activity by people because of, frankly, just the fear that would have been present. We are very, very fortunate in Australia not to have faced those circumstances that other countries have faced.
So just very quickly, are you aware of any major forecaster, public or private, that was able to accurately predict either the health outcomes or the economic outcomes?
No, it's a good question. There are a wide variety. There's a lot of very accurate forecasters after the fact, I'm noticing at the moment, but not many
it's the
before
best kind of forecasting, isn't it?
Not many before the fact, I think.
But this is the point, Sandra. I mean, it was a genuinely rapidly evolving situation in a very, very severe way. And, we were planning for the worst. And, the context at the end of March, even though it was only 2 months prior to the recosting, was substantially different. And so, of course, the fiscal outlook in relation to the same program in the context of a massively improved circumstance is going to be different. And, I mean, any reasonable person will understand that.
In my remaining time, I just want to move to a bit more broader economic questions. As interested as I know my constituents are in estimates variations and the subtleties of budget forecasts, I know they're a bit more interested in jobs and the health of the economy more broadly. Since you last appeared before the committee, we now know that Australia is in a recession, not that that will be a particular surprise to anyone. How is Australia's economic performance ranking against other similar countries?
Well, our performance is frankly ranking very well, primarily driven by the health decisions, I would say, in the first instance. The programs are incredibly important, but if the disease was spreading rapidly through the country and the population was concerned and we'd seen the types of fatalities which other countries experience on a daily basis that we've experienced in total, I think there would be a very different dynamic. But instead, those health decisions have been timely and prudent and have seen us in a much better position, and they see us in a better position from an economic perspective. So we have steadily revised down our estimates of the economic impact of the health measures and other measures. But it will still be, as I said in my opening statement, a very significant shock to the economy and one we've never experienced, because not only, as I've mentioned, I'll just say this very quickly, but there are the two dimensions here. There are the supply side, the fact that governments, through their health restrictions, have stopped activity. And then secondly, there is the demand side. There is the precautionary side, people putting money aside, people actually getting ahead on their mortgage repayments because they're concerned about future employment. Confidence is returning. Business and consumer confidence is returning. It will be crucial to the recovery. It will be driven by confidence that the health issues are well managed. And then as people see a cycle of positive economic activity and people get back to work, we will see recovery. But we are well ahead of what I imagined we would be in March when we put these estimates together.
How does that 0.3% decline in the March quarter compare to other countries?
It's a very small fall compared to other countries. Other countries saw record falls in the March quarter. They will see much larger falls in the June quarter. We will see a large fall in the June quarter. I still expect to see a large fall in that quarter, but I do not think it will be nearly as large as what many other countries will experience.
And not as much as we expected we would experience either.
No.
And what does that mean for the recovery of the Australian economy after the June quarter?
So, interestingly, they may have higher growth rates, but if you like, they're coming off a much lower base. The level of our economy will be higher. It leaves us much better placed to avoid some of the devastating circumstances of very large falls where many businesses go broke and then they have to let their employees, well, obviously go broke, their employees lose their jobs, they have to be re-established. If we can avoid that cycle of destruction, and we have done well to date, but we still have quite a way to go, it will enable us to recover much more quickly.
Okay. Thank you, Dr. Kennedy. Thank you, Chair.